All right, last reproductive lesson. We are wrapping it up. This is safe sex and STIs. We previously discussed the anatomy of the female and male reproductive systems. We're talking about those who are assigned at birth, female and male. We talked about fetal development. We talked about pregnancy and birth, and then we talked about birth control. But now we're going to focus on safe sex and STIs. Okay, so again, this is our last lesson for the reproductive system. So safe sex is emotional as well as physical. So safe sex must involve consent. Consent is voluntary, consent is mutual, consent is knowing, consent can change at any time. Consent must be given through words and actions, okay? Silence, lack of resistance, that's not consent, okay? So consent is clear, coherent, willing, and ongoing. Clear, so words, actions, and mutually agreed upon. Okay, it is never implied. So if a no is not said, it is not assumed that it is yes. Yes, yes. Consent must be clear. Maybe doesn't count. I'm not sure. I don't know. Don't count. Not consent. Yes. Clear. Coherent. If you are incapacitated or unable to make clear decisions due to effects of drugs or alcohol, can't give consent. Willing, that means consent is not pressured. Okay, if there's an imbalance in power, like a boss and an intern can't consent. Okay, there's an imbalance of power. Can't get consent through threat of physical or actual physical violence. Okay, or through emotional manipulation. And consent is ongoing. That means if I say yes today, that doesn't mean I have to say yes in an hour or tomorrow or 2 days from now. Consent has to be given every time. All right, so some 4 ways to think about it: confirmation, communication, lubrication, and enthusiastic participation. The shuns, the 4 shuns. So confirmation, that means I consent. It's age appropriate. There's no imbalance of power. Communication, before, during, after. Talk. Consent. Lubrication, natural and added if needed. Okay. Enthusiastic participation, that means having a good time and expressing that. Sexually transmitted infections. So again, previously it was called STDs. Again, changing that diseases to infections to kind of reduce some of that stigma associated with sexually transmitted infections. So how are they spread? Predominantly through vaginal, anal, and oral sex, but also some can be spread from blood-to-blood contact, or in some cases, skin-to-skin contact with an infected area. So skin-to-skin contact doesn't mean hand-to-hand, okay? But we'll talk about that when we get to the different types of STIs. So why STIs spread so fast? Here's the little STI wheel, okay? And most of these we will be talking about. First, some cannot be identified. Maybe they're not symptomatic at first. There's a lack of communication. A lot of people unwilling to share their sexual history and sexually transmitted infection history. So it could be unknown. There might be a lack of testing, but at school you can get tested at the nurse. There's ECMC, Planned Parenthood, your healthcare provider. If you do go to college, health centers on campus have free testing. Now, the only 100% way to avoid an STI is to not have vaginal, anal, or oral sex. The reality is this: if you are engaging in sex, vaginal, anal, or oral, and the more times that you do, the odds that you will get an STI increase. Okay. But it's the same like if you're around people, you're going to get a cold. Okay. That doesn't mean it's not a big deal. That doesn't mean you shouldn't take it seriously, but it is not the end of the world. And it is very common, more common than people realize. And that's hopefully what I'm going to talk about. So again, the days that it takes for symptoms to occur are part of the reason that some people may not even be aware that they have an STI because literally they haven't even shown any symptoms yet. Okay, so young people, ages 15 to 24, make up about 27% of the sexually active population, but account for 50% of the STIs in the United States every year. And if you look at this graphic on the top, you can see that gonorrhea and chlamydia, as well as HPV and herpes, are predominantly in the 15 to 24 age group. Okay, HIV and syphilis tend to be not in that age group, but doesn't mean it doesn't happen. Okay, it means young people in ages 15 to 24 are accounting for more of a percent of STIs than they should be based on their numbers in the population. So, do you think you have an STI? Some questions you might ask yourself: is it painful when you urinate? Do you have itching, burning, or inflamed genitals? And do you have any discharge? Okay, also, do you see any sores or lesions, anything like that? You might have an STI. Now, itching, burning, painful urination could also be a urinary tract infection. So it's just important to communicate with your doctor and get tested so you know actually how to treat it. So some of the images shown may be graphic. So syphilis. So syphilis is a bacterial infection. It's spread by skin to skin contact as well as through sexual contact. Skin to skin contact with sores. So you can see the sores are not just in the genital region. So it starts as a painless sore. It can remain dormant before becoming active, and it can be fatal if left untreated. It's curable with penicillin. There was an extremely unethical Tuskegee study that was done on Black males to see the effects and treatments of syphilis, and this is unfortunately a very dark mark on the history in the United States. Gonorrhea, some people may refer to this as the clap. I just like to refer to it as gonorrhea. It's the second most common bacterial STI in the United States. Again, can pass through oral, vaginal, anal sex. Tends to target warm, moist areas of the body. It's cured with antibiotics, but antibiotic resistance is becoming a problem with gonorrhea because it is the second most common. And if it is untreated, it can cause infertility. So I'm going to show, I don't know who this person was who posed for this World War II government poster, and I don't know if this person knew this is what they were posing for. And this was an attempt to limit the spread of, at the time called VD, venereal diseases, then called STDs, now STIs. So again, stigma, kind of putting it on pickup girls and good time girls and prostitutes, when in reality, sexually transmitted infections can be spread back and forth. So if one partner is treated and the other partner doesn't get tested or doesn't even know the other partner was treated. So communication is key in making sure there is effective treatment because it can get passed back and forth. All right, oral herpes is HSV1, herpes simplex virus 1. Cold sores, fever blisters. About 60 to 90% of the population is estimated to be affected. It can be spread during oral sex, and it can cause genital herpes. Genital herpes, which we'll see, is mostly caused by HSV2, but if someone with an active cold sore performs oral sex on someone, that person can then have genital herpes from that. It's not like it's oral herpes, it stays oral. Genital herpes is HSV2, herpes simplex virus 2. About 1 in 6 people, or 16% of the population, do have this form of herpes, genital herpes. There's no vaccine for either type of herpes, but antivirals can reduce outbreaks and then therefore transmission. It's spread by skin-to-skin contact with affected areas, saliva, sex, genital secretions. Okay. Pubic lice. So this is distantly related to head and body lice. Main symptom is itching. It can be spread through sexual contact, but also shared towels, shared bedding, shared clothing. And it's treated with a prescription lotion, similar to ways that you would treat lice in other areas. All right, HIV and AIDS. HIV damages your immune system. It kills T cells, basically making T cells unable to do their job of fighting off infections. So over time, as more and more T cells are destroyed, the body is less likely to fight off infections. So you can get sick from something that might not normally have made you sick. So it's transmitted through blood, semen, vaginal fluids. It's lifelong, but is manageable with care. Without treatment, HIV can turn into AIDS, acquired immunodeficiency syndrome, and that means the immune system is too weak to respond or fight off other conditions. So you might die from pneumonia because if you have HIV, which has progressed to AIDS, because your immune system is unable to fight it off. So there is something called PrEP or pre-exposure prophylaxis that can keep your sexual partner safe from HIV. So it's something that someone who is not infected with HIV takes to help prevent actually getting HIV. And it may be because you are unsure about your partner. It may be because you know your partner is HIV positive. And this is often used with other forms of birth control, specifically condoms, to prevent the spread. So HIV is not transmitted by insect bites, toilet seats, kissing, sharing cutlery, touching. Okay, important to know. HPV, most common STI around the world. No cure, but the HPV vaccine, Gardasil, can prevent some strains. The vaccine, though, is not beneficial to someone who's already infected, so it's best given before exposure, which is why a lot of places try to vaccinate prepubescent children. There's over 100 types of HPV. Only a few are high risk. Most of them, if we are infected with HPV, just get better, and we don't even know we are infected. That's what happened to me. So I'll tell a story about myself. I actually only know that I had an HPV infection because I had an abnormal pap smear in my 20s. And they did a procedure called a LEAP procedure and removed the abnormal cells. They were not cancerous, just growing abnormally. And then I have not had a single abnormal pap smear since. But again, I did not know I had HPV. My body just recovered from it. I had no outward symptoms of it. It just, again, I only knew because of the abnormal pap smear. So some strains of HPV are linked to cervical cancer, also other genital tract cancers, vaginal cancer, cancer of the vagina, of the anus, penile cancer. Other ones are linked to just cervical cancer. Some are linked to just genital warts. And then some, like I suspect the one that I had, which my body just recovered from, although it may have been a higher risk strain, I just didn't develop cancer from it, and possibly because I did go for regular pap smear. So again, it's the human papillomavirus. More than 100 types, about 40 are spread through sexual contact. It can be transmitted from skin to skin contact. So condoms do not provide 100% protection. That does not mean I'm saying don't use condoms. It just means be aware. Okay, just like when we're around people, even now we may be masked, but we still might get sick. There still is a risk. So if you're going to choose to engage in sexual contact, whether it's vaginal, anal, or oral, understand that STIs are a risk. So you accept the risk if you choose. There are often no symptoms. Could be a cold you didn't know about. It can result in warts and lesions, like shown in the previous illustration. And again, Can cause other cancers: vulva, vagina, penis, anus, mouth, and throat. Okay. Chlamydia is a common bacterial infection, about 1.7 million cases in the US in 2020. Affects all sexes, it can damage the reproductive system. It can make it difficult to get pregnant. Again, vaginal, anal, oral sex, also some genital contact. It cannot be spread through kissing, sharing towels, using the same toilet seat. It can be cured with antibiotics, so get tested. All right, so the stigma behind STIs. There's a lot of misinformation. There's a lot of fear mongering, conflicting articles, materials. Also depicted negatively in movies and TV shows, like the comment from The Hangover: "What happens in Vegas stays in Vegas. Sever herpes. I'll take that home with you," or however it was said. And it happens a lot. So talk about sex and talk about STIs without scare tactics or shaming. Like I said, if you choose to engage in sex, whether it's vaginal, whether it's oral, whether it's anal, it's possible you could get an STI. So regularly get tested. Talk to your partners. Talk to your doctor. Just like if you're around people, you're probably going to get a cold. It's similar. Because even if you are using protection, it's still possible for some STIs to spread. So have conversations about sexual health and safe sex more often. Understand sexual health is not the absence of infection. It means you're physically, emotionally, mentally, socially, you have you're in a good place as far as your sexual health. Reconsider the language using. Use medically accurate language, non-blaming. Stop saying clean. You can say positive or negative test results. Okay, clean implies someone who tested positive would be dirty. It's not the language we want to use. Listen to others' experiences. And remember, STIs are extremely common. That doesn't mean you're a bad person if you get an STI. It doesn't mean you're dirty. It doesn't mean you did something wrong. You could have done everything right and still ended up with an STI. So what STIs can spread with skin-to-skin contact? Herpes, HPV, syphilis, pubic lice. Okay, so again, using condoms is not 100% protection. I do not advocate not using condoms. Just recognize that using condoms is not a guarantee